My name is Timo. I'm from Germany, living close to Heidelberg, and my diagnosis is TGCT. I was first diagnosed with TGCT in 2015. Well, actually I was diagnosed in 2016, but in 2015 the issues started. I was very active, playing lots of sports, went to the gym 3 times a week, played soccer 2 or 3 times a week, and I started having knee pain and swelling in my knee. So I went to a lot of doctors, and they always sent me to a physical therapist, and I got liquid removed out of my leg, out of my knee. And I went to multiple doctors. None of them actually knew what I had. So in July of 2016, I went to a doctor that sent me to an MRI. And when I had the MRI, they diagnosed me with a tumor inside my knee, but they didn't know what it was at that point. So after the MRI, they wanted me to get a surgery really quickly because they weren't sure what it was. So just a week after my MRI, I had my first surgery. It was open front and they removed it. It was pretty big, about 8 times 7 times 6 centimeters. And when the biopsy came back, they diagnosed me with PVNS, which was the name back then. Now we are talking about TGCT. At the first moment, when people tell you you have a tumor, obviously you're scared, you don't know what's going on. And I was ready for the surgery. So after I got my results from histology, from the histology report, I started Googling because no one could really tell me, like the doctors couldn't tell me much about the diagnosis they gave me. I just read it's a tumor disease. So I Googled a lot. I was scared at first, but my recovery was pretty quickly, so I wasn't too scared at that point, and I could even go back to sports, but that's where everything got worse. Meeting other patients was a game changer to me because through a Facebook group that I found, I got to know Sydney. Sydney is very well known for patients with TGCT. She's a patient herself, and she's also working as a doctor, and getting to know her helped me a lot, just talking to people about having the same issues, having the same trouble, having the same pain. And also through her I got to meet some other patients, and that just makes it so much easier because people in your environment, they don't really know what you're dealing with, but other patients do. So that helped a lot. In the beginning, I dealt with it fairly fine. I was scared in the beginning, but after surgery, I could go back to sports and I got my life back pretty much. I worked just like a normal person pretty much. But once it advanced and I had multiple surgeries and RSOs, it started getting worse every single time. I had more pain. I lost hobbies that I've always performed. I had trouble in my job. I couldn't work as I did before. So it was hard, definitely, but I had family and friends who supported me. I had patients that listened to me, so that was very helpful. The biggest challenge in being diagnosed with TGCT and the symptoms, I would say, are the biggest challenge because pain, movement, hobbies that you lose, jobs that you can't perform anymore. I think that's the biggest issue, and coping with it is very hard because losing your job, like it happened to me, changes a lot of things financially, family-wise. So you need to find ways to deal with it, and that's the biggest challenge, like how to deal with your diagnosis and how to deal with the symptoms that you have. My journey started, as I said, in 2015 with symptoms that I had, and with the first surgery in 2016. Since then, I've had 6 surgeries, all different kinds: open back, open front, arthroscopical. And I also had 2 radiosynovectomies, which is like injections with radiology, whatever, which is not supposed to happen anymore with today's standards, but back then they still performed it. I'm happy that it's not the case anymore because I felt like it didn't help me at all. It made it worse. Also in July of 2014, I started with my first medical therapy, imatinib, and I did that for about 10 months. The side effects were not nice, but I could deal with them. Mostly nauseous, fatigue, swellings. And at first I was very happy with it because the tumor growth stopped. That was the first time ever. Like, the tumors always grew. Now they didn't anymore. But at one point they started growing again a little bit, and the side effects compared to the use that was there was not enough. So we decided to get off the treatment. And right now, as we are doing this, I'm starting with vimseltinib therapy, which is the new medication that got certified in Europe for us TGCT patients. I think the biggest obstacle still today is finding the right place to treat you. I've been with sport orthopedics for mostly the whole time of my journey, until I actually went to professional places, so-called tumor oncologists or tumor surgeons. I went to Munich to Professor Dürr. I also went to Essen to Professor Bauer. They both have different areas where they are really good in. Professor Dürr is for the surgical part, Professor Bauer is for the medicational part. And meeting them actually helped in getting the right treatment and getting the right information. And if I would have went to a place like that in the very beginning, I think lots of things could have been better. And I have some regrets, obviously, but yeah, it happened the way it did, and now I have to cope with it. As I said before, I was very, very athletic. I did sports pretty much every day, and I can't do that anymore. So that took away a big part of what I love to do. And right now, I'd say I'm still finding, or I'm still looking for a hobby that I love as much as I did love athletics back then. But what really helped me and helped me spend my time right is having a baby. And my son is turning 2 now, and I think I spend most time with him. And also I still work for a soccer club, a professional soccer club, and I do scouting for pretty much ages U17 until U21. So that is helping me still being active or still being part of soccer, not playing myself anymore, but still being a part of it in some ways. I always say fight TGCT, and I also have a little tattoo of it. So yeah, I just want to fight that disease and want to help people that get diagnosed right now to get better care and yeah, just be there for them. Not every journey is the same. That's most important to me because like I haven't had a very great journey, but that's not always the case. There's 2 different versions of TGCT. One is the diffuse form and one is the nodular form. And there's people that only have 1 surgery, and after that they're totally fine. They will never have to deal with it again. So be positive. Don't think too badly about what's going to happen. Yeah, and get informed and meet people that have the same disease to find out more about it. I would definitely say that I learned things from TGCT, like self-care. It's a big part. Learning to know my body better. Like, I just feel if something is wrong now, which before, like, I didn't have that feeling for my body. Also, I learned about medication a lot, which yeah, is very helpful because taking lots of medication, yeah, you just read about it, you find things out about it, and the ways that there's treatments now that weren't there back then, that helps a lot. Like, when I was diagnosed, no one talked about medical treatment. It was always surgery, surgery, surgery. And now we have ways to deal with it through medication without having to perform surgeries. So my biggest wish would probably be that people see our disease as something more important, I'd say, because since our disease is non-benign, people sometimes laugh it off or don't understand how life-taking it actually is. Like obviously you don't die from it in mostly every certain way, but it just changes your life in so many ways that I wish people would see our disease as something more important. I would love to give a big shout out to Sydney as a patient advocate who does so much for all of us patients, and to everyone who supports the group and donates to it, because without that group we wouldn't have all the options that we have today. And also I think it's a very big deal for your family and your friends to deal with the disease as well. It's not just you dealing with it, they have to go through all of it as well. And I just want to tell everyone that has a part in TGCT that they are very supportive for us patients.